The Genuine Pearl Girls and Rimini Kids Foundation work around the world through children's charities like St. Jude Children's Research Hospital and Orphans of Indonesia. Join us in making a difference. Visit GenuinePearlGirls.com or RiminiKidsFoundation.com. You're watching Prescription for Healthy Lifestyles with Edie Hand and Dr. Daniel Potts.
Prevention and wellness is such a hot topic right now because we have a healthcare cost crisis in this country and globally, and it's driven because of a health crisis itself. It's the expanding burden of chronic illness and health risks that lead to those illnesses that's the major problem. And the solution is preventive medicine. What we're finding is that we're on the verge of transforming our sick care system to a true health system. Instead of being so illness-based and reactive in our approaches, we're becoming much more wellness-based and proactive in our approach. And that's encouraging news. I mean, Ben Franklin said it right back in 1736. He said, "An ounce of prevention is worth a pound of cure." So we've known this for centuries, but preventive medicine is an idea whose time has finally come. And what do they say? Even a legion of horses cannot hold back an idea whose time has come. There's a big interest in all sectors of society around personal wellness and enhanced well-being, vitality, enjoying not only a higher quality of life, but a greater quantity of life, adding life to our years as well as years to our life. And I think that also in our culture, we're beginning to see that prevention and wellness is the new green, part of the new green movement. And not only being interested in our sustainability in our external environment, but our sustainability in our personal internal environment. So when we talk about evidence-based preventive medicine solutions, like the ones we have at U.S. Preventive Medicine and using the prevention plan, in a study that we did showing the impact on health risk reduction of individuals that had been on their own personalized prevention plan for 12 months. What we found was there was over a 60% reduction of people that had high health risks moving down to either medium or low health risk within 12 months of being on the prevention plan. Now that's significant because we measured their health risk assessment as well as blood test results and blood pressure and weight at baseline and then 12 months following participating in their own personalized prevention plan. We also showed individual risk cohorts positive changes. So in other words, of the people that had high risk blood pressure, so their blood pressure was higher than 140/90 at baseline, after 12 months on the prevention plan, 42% of those people came down out of that high risk blood pressure category. And of people that had elevated blood sugar, so they were in a pre-diabetes range. The train's on the track, the ticket's paid for. They're likely going to develop diabetes if they don't make a change. After 12 months on the prevention plan and starting out with an elevated blood sugar, 31% of those people came back to normal levels of blood sugar, back from the brink of developing diabetes. Those are tremendous positive improvements. I mean, if the prevention plan results were because of a pill, it'd be a blockbuster drug. But what we're realizing, it's not the power of the pill, it's the power of the will of individuals and helping empower them and support them for sustainable health behavior change. Over 80% of type 2 diabetes and heart disease and over 40% of cancer are preventable if Americans just did three main things: stop smoking, ate healthy, and got regular physical activity. Now the challenge is, that says easy and does hard for many people. But that's why solutions that are engaging and exciting and interesting, like the prevention plan, that get people motivated and involved in managing their health, they're able to enjoy the benefits of that for a whole life. A lot of people think that maybe it's not as important as it really is. They think maybe the genetic risks or something that just they're predisposed to are what overwhelms their health situation. But the reality is this: over half of all causes of death in the United States are related to lifestyle, health behaviors. Only 20% are related to genetics, heredity. So we can't blame our parents for the majority of our health situation. And we can actually do something about improving our health and the benefits of that. One of my professors, I'm board certified in preventive medicine, and one of my professors in my training program summed it up this way. He said, largely how we live dictates how we die. So it is so important that we embrace even some of those simple daily decisions of just eating a little healthier, maybe more vegetables in our diet, maybe exercising a little more. I'm not talking about running a marathon. I'm just talking about some regular walks. And just being able to do those basic things can make such a difference in the way one feels, as well as all the health benefits that come from that.
Prescription for Healthy Lifestyles is brought to you in part by U.S. Preventive Medicine. More good years.
Can you imagine a world without children? A world where children don't play, or dream, or imagine.
At St. Jude Children's Research Hospital, we're working every day to find cures for diseases that strike down children. Because we can't imagine a world without children. Can you?
Finding cures, saving children. St. Jude Children's Research Hospital. Call now or log on to stjude.org.
Hi, I'm Edie Hand, and I want to celebrate our kids globally. It's RaminiKidsFoundation.com and the EdieHandFoundation.org. We're doing this through our Genuine Pearl Girls for acts of kindness. And if you'd like to join us, all you have to do is log on to GenuinePearlGirls.com. Make a difference for a child today.